Welcome to Women in Healthcare Leadership podcast series brought to you by Medscape Education. Our goal is to provide a platform where we can educate, advocate, and inspire women leaders to lift as they rise. With every episode, you'll hear from her as we showcase the perspectives, insights, and experiences of women who are leading the way in advancing women's health and empowering the next generation of women in healthcare.
My name is Stacey Hughes, and I have the absolute incredible pleasure to be here with Dr. Shikha Jain, and we are coming to you from the Women in Medicine Summit in Chicago. Dr. Jain, it's a pleasure. I am in awe of all you have accomplished this weekend, and I would love to know more about it. So let's start with, how did you get into medicine? How did you get into this?
It's a really good question. So I will say that this is not something I thought I would be doing. I never saw myself as someone trying to advocate for equity in healthcare. It was not even in my eye line. I became a physician because when I was little, I always knew I really liked science and I really liked helping people. And I used to, on the weekends, go round with my dad in the hospital. And this was back in the day where you could actually round with your dad in the hospital, and I'd actually go see some patients with him. And if there were patients I couldn't see, I would have to sit and wait at the nurse's station, and they'd give me candy, and it was like the best way to spend a Sunday. I remember one day, my dad is a surgeon, and so I saw somebody who had staples in their leg and after surgery, and so I went home and tried to staple my brother. I was not allowed to go back to the hospital for a little bit after that, but I always knew that I wanted to be a doctor, despite throughout my life being told by many of my teachers and advisors and guidance counselors that maybe I wasn't smart enough, maybe I should be a party planner. A PI in my lab actually told me that I get more excited over planning parties than I do about science, and so I should just be a party planner. And I said, thank you very much. I am leaving your lab. But so for me, being a physician was something, it was a hard road to get there for a variety of reasons. It's hard for everyone in their own way. But I always knew that that's what I wanted to do. Fast forward to, I am now attending physician. I've navigated all sorts of barriers that women in medicine navigate. And I thought that the problems I faced were my fault. I faced challenges that I've talked about before, where I had a challenging pregnancy. I went on a maternity leave. I had struggles when I came back because of things that I thought were my fault. But in hindsight, they were not. And I did not realize that. And it's still, even today, there are things where I wonder, was that my fault, or was it something that was external that shouldn't have happened? I became a faculty member. I got pregnant with twins, unexpected twins, and came back from maternity leave empowered, because I talked to a lot of women when I was on maternity leave who had told me stories very similar to the things that I had faced. And I was floored, because I said, these stories sound like me. And when I hear them saying it, I stand up and I say, I can't believe that happened to you. That's not right. But then I would reflect and say, oh my gosh, that is my story. Why did I not realize that I was being marginalized or targeted, or barriers were put in my way that shouldn't be there? And I said, I want to do something about it, because I was raised, if you find a problem, you need to come up with a solution. And so that is what I wanted to do. I wanted to come up with a solution. Obviously, there's no easy solution for this, but my first step was, I want to create a conference that brings these women together, because my challenge was, I wasn't really active on social media at that time, and I didn't have a community of people I could talk to. I had friends and I had women who I knew were in medicine, but no one who I could say, I went through this. What do I do? And my dad and my mom are my biggest sponsors, mentors, advocates. My husband is amazing, but they could only listen and they could support, but none of them had been through what I had been through. And so I realized I relied on them for a lot of emotional support and a lot of guidance, and I still do, but I needed to talk to other people who'd been through what I'd been through. And I said, so selfishly, I said, well, I'm going to bring all these people together. And so that's what I did. And so I actually, before I even created the summit, I was at Northwestern University, and I created the Women in Medicine Symposium there, which continues on.
I was going to ask, because going to a conference, that is a big step.
Yeah.
So you had started with the symposium.
So I started with the symposium at Northwestern, and it went incredibly well. We ended up with, I think, over 200 people there the first year. And it was so well attended. The senior leadership there was shocked because they didn't realize how much of a need this was. And now I'm happy to say the programming has continued despite the fact I'm no longer at Northwestern. And so after I did that, I left Northwestern a year later because I was recruited to another institution with a leadership position. And I said, I want to make this bigger because it was so great the first year we did it. I want this to be something where people say, I want to go to the Women in Medicine Summit because I know, one, I will find my people, I will find a network, I will find opportunities, I will find sponsorship, I will find mentorship. And more than that, I will leave feeling better about myself. I will leave feeling like I am good enough and like I know that the things that I've gone through are not my fault. And that if any message comes out of this whole conference, I want people to know, yes, we are not perfect. I make mistakes. We all make mistakes, but we learn from them. When you are making mistakes and you're willing to accept constructive feedback and you want to get better, that is how we should be doing things as physicians. What's not okay is when we're doing those things and we're targeted and bullied and harassed and made to feel like the problems are our fault. And so I want people to leave here knowing that it's not your fault, that there are other people who've been in that situation, and we are all here to help and support you get to the next level in your career, or even just survive whatever situation you're in, because everyone's not always looking to get to the next level. Sometimes it's just about survival in a situation that might not be ideal. And so we just provide opportunities for people to connect with any type of person across the country and now internationally that may be able to help you somewhere in your journey.
You mentioned sponsorship and mentorship. Can you elaborate a little bit more? That's the first time I've heard of the sponsorship aspect. So I'd love to hear your definition of it, and that seems to be a driving force for you.
Yeah, mentorship, I think, is really a lot of when you have like a task you need to get done, or you have a talk you need to give, or you're trying to figure out, how do I navigate my career? It's somebody sitting down and advising you and giving you guidance and helping you and mentoring you to be the best person you can be. Sponsorship is when you're sitting in a boardroom and somebody says your name and says, I think Shikha Jain would be great for this leadership opportunity. Next step, it's when people are mentioning your name and you're not in the room and they say, we have a search committee out. Do you have any names to suggest? And your name gets put in the hat. Sponsorship is when you suggest people for opportunities, when you nominate them for awards, when you take the action steps that need to be taken to actually make the changes. And we published a paper, I think about a year or two ago in Nature on the mentor-sponsor continuum, where a lot of times people think distinctly, this is a mentor, this is a sponsor, which is true. But there's also the opportunity to be a sponsor, so give somebody an opportunity, and then mentor them to be successful. Mm-hmm. And for me, the two best examples I can think of for that for me are my dad, because he's done that for me since I was a kid, and to Dr. Julie Silber. She sponsored me for a conference at Harvard that she was leading. And then when I sent her my slides, she said, okay, let's talk about how we can improve these slides so that they best resonate with the audience that is here. And it ended up being a great talk because of her input, and her sponsorship got me there, but her mentorship kept me there. So now I've been able to give that talk multiple years in a row because she mentored me to make sure that I would be successful when I presented.
Wow. So what are some of the biggest gaps that we're still facing in healthcare?
So many. I could talk for hours. The pay gap is a real problem.
Okay.
And people say all the time, you're a doctor. Doctors make money. Like, why are you complaining about money and advocating for it? And I say, you're absolutely right. We are a very privileged class of people for the most part. But if two people are doing the exact same work and one is getting $100 and the other is getting $80, that is not fair. Not only is it not fair, it's not right. And it's contributing to the burnout in our field. It's contributing to women leaving medicine, and that then impacts patient outcomes. It impacts patient mortality, morbidity, surgical outcomes. It impacts retention. So the pay gap, I think, is a real problem, and that needs to be fixed soon because we're hemorrhaging amazing women from medicine. We also need to really think about this leadership gap because things don't change if you have the same people leading for years and years and years. We talk about term limits. There should be term limits. And the thing that a lot of people say is, well, if someone's doing the job well, then they should stay in that job, which, that's great if someone's doing the job well. But at some point, the ideas get stagnant. The ideas get stale, and you need new ideas and new blood to come in. And it doesn't have to be someone who looks and sounds exactly like the previous leader. it actually is better for organizations if the leadership at the top looks more like the people and the communities that you're serving, because it's been shown time and time again that actually improves your bottom line. It improves monetary benefits. It improves breast gaining scores. There's so many things it improves. There's no reason why we shouldn't be focusing on closing that leadership gap, because it will improve our institutions. And we know women make phenomenal leaders. It's not a question. It just is a fact. So, and I mean, not all women, obviously, just like all men aren't great leaders. This isn't a stereotype to say women are better leaders than men. There are a lot of amazing women leaders out there who aren't getting tapped on the shoulder because they don't look like the previous person. And we need to break out of that mold of thinking that we need to have this homogenous idea of what a leader is. Leaders come in all shapes and sizes, and that's really how we change things and how we transform. So those are two of the biggest things. But I mean, it goes all the way to award nominations. We have huge gaps in award nominations. We have huge gaps in just women being voluntold to be on committees and doing invisible work. Women are doing the work that is necessary to grow organizations and companies, and they aren't getting accolades for it. They're not getting money for it. They're not getting any sort of benefit, but they're doing the invisible work that's then getting the organization's awards. So Lean In and McKinsey came out with a report talking about this specifically in the corporate world, and it's just as prevalent in the healthcare space. So we need to rethink how we compensate our physicians. The RVU-based model focuses on how many patients can you see in a day, and it's very much assembly line. That's not how medicine can really be practiced if you want to be the best doctor you can be. And it doesn't take into account all of that invisible but very essential, necessary work that has to be done in order to keep patients healthy, in order to keep hospitals functioning. So we need to rethink the compensation model that was initially created before women were even in the workforce and has now evolved into this RVU model that is based off of this model that was there previously, that is not a model that works for the way the healthcare system is currently set up.
So one thing that's really resonating me here at this conference is the phrase, lift as you rise. I absolutely love that. Anyone listening to this podcast, if you could give advice on one or two things that could help really bring that to life, what would they be?
Lifting as you rise really means bringing up the next person with you. And it doesn't have to be somebody junior. It could be somebody at the same level as you. Could even be someone more senior than you. You can lift up anyone as you rise. The easiest way to do that, and anyone can do it, a student, a trainee, an attending, a dean, a CMO, all you have to do is think, would this opportunity be good for someone I know? And then go the next step and think, okay, I've thought about my normal people who I normally ask. What about my next circle? What about people I don't normally think of? Do I need to reach out to someone else and say, hey, there's an opportunity. Do you have anyone you would suggest? Somebody who is normally overlooked but might be great for this position? Because we all get into the habit of saying, oh, I know somebody, my friend so-and-so would be great for this, which is wonderful. And that is sponsorship in its own level. But at some point, taking that next step and thinking, is there someone that I'm missing? Is there someone else whose voice would be so important and relevant at this table? Who can we bring that is going to change the dialogue? And sponsoring that person. That's number one. Number two is don't be scared to speak up for yourself or speak up for others. Because in medicine especially, we're such a hierarchical society that we do a lot of protection of ourselves for self-preservation, and it needs to happen. And I'm not out there telling people, step out of your comfort zone and get fired by saying something to stand up for yourself. What I am saying is we need to sometimes push the boundaries and be a little uncomfortable, especially if we're in positions of power, because if we don't, we're not going to be able to actually be the change that we want to see. And in order to do that, we have to sometimes advocate in spaces and in ways that may make us uncomfortable. And I've been there, and it's hard and it's scary. It's actually terrifying. And I don't I don't live up to the challenge every time. I can't. It's not possible. But I do my best to try. And that's all I can ask people is try. Try to be that upstander. Try to be that person in the room who people know if someone says something, you're going to stand up for them. Be that person who people know they can come to if they're getting harassed or targeted. I tell every person I work with, if something happens to you and you don't know who to go to, come find me. I may not know how to help you, but I will figure out who can. And people need that. I have students all the time who come to me and say, I wasn't even going to report this because I didn't even know where to go. And that breaks my heart. So if you're going to take anything from this episode, I would say be the change you want to see, but more than that, be the advocate that you want for yourself.
I love that. So I know Women in Medicine Summit 2024 is already in the books. What is it? September 13th and 14th of next year.
13th and 14th.
Yeah, back here at the Drake, which is an absolute beautiful venue. What are you looking forward to for the future of this organization? Because the sky's the limit for you, Dr. Jain.
Thank you. We are growing very fast, which is amazing. One thing that I've tried to do, and I've been very intentional on, is highlighting other amazing physicians who are doing incredible work. Like yesterday, we had the fashion show with Taryn Rose, her shoes from Enrico Cuny. We had Green Cloud Scrubs with Dr. Lori Bose. We had Dr. Ona was here with her tribal eye sunglasses. I mean, I want to do innovative things, and I want to partner with as many people as I can, because lifting as you rise isn't just about people. It's also about helping people succeed. And so like last year, our Friday evening event, we had the Nocturnist was here, and they did live narrative healthcare worker stories on stage. I really want to find organizations that are interested in really striving for change and partnering with them and bringing them here and having them see what we do and what we're capable of. Because at the end of the day, we had a lot of men here this year.
That was surprising.
Which I was really happy about. And part of the reason that they came was because they had women who brought them here and women who sponsored them to come. And the biggest thing that stood out to me is these men have come up to me time and time again and said, I cannot believe, number one, the powerhouse speakers you have. Number two, the fact you've created such a safe space that these leaders, international leaders, are up on stage being vulnerable and sharing stories that normally you would not hear from leaders. And number three, you've created a space where people can come to you and say, I want to be involved and I don't know how. And I create pathways for anyone who wants to be involved, be it a company, a person, a nonprofit, whatever it is. And so I see us continuing to grow. I see us continuing to grow in spaces that I can't even imagine, because right now, if you told me 5 years ago I'd be sitting here talking to you about this, I would have laughed. I did not envision that we would get this big and have this much success in this amount of time. And I don't think of success in the way I think many people do. Sometimes people think of success monetarily. We don't make money. I wish we did, but we don't. Maybe someday we will, and you can come back and I'll say we're rich. I do this. Success to me is those stories of these women who come to me after the conference or during the conference or message me on Twitter or email me and say, your programming changed my life. Your conference changed my career trajectory. I was in a bad place and I'm now in a new position. I met a new colleague who advocated for me. I found somebody to collaborate on research with. That to me is success. And every year when I'm asking myself, why do I do this in my free time? And my husband's asking me, why do you do this in your free time? I pull up those emails and I say, this is why I do this. We are successful because we are changing medicine one person at a time, and we're doing it as a collective. And to me, the power of all of us here in this space is too much for me to ever walk away from. It's just too amazing. And I want to keep bringing people into this space and into this circle and help do things to disrupt healthcare for the better.
Absolutely amazing, Dr. Jain. I want to thank you so much for taking time to talk to us. It's been an absolute pleasure.
Thank you so much for having me. This was lovely, and I'm happy you all are here, and I hope we see you back next year.
Yes, you can count on it.
Thanks for joining us. Tune in next week as we continue our journey to amplify the voices of women leaders in pharma and medicine. Hear From Her is brought to you by Medscape Education. Please subscribe to Hear From Her on your preferred podcast channel and follow us on LinkedIn. Until next week, remember to lift as you rise.